Welcome to IQ Health. I'm Dr. Alan Siegel, your host. Our show is dedicated to educating you on making intelligent health and wellness care decisions. Today we have a very special guest, Sandra Mendelson. Sandra is a certified holistic health practitioner and specialist in soft laser therapy. Thank you, Sandra, for coming.
Thank you for having me.
Sandra, what is soft laser therapy?
Soft laser therapy is a means of using the power of light to regenerate the body at the cellular level. It's used to activate, detoxify, and balance key bodily systems like organs, glands, and tissues.
Okay, so the light therapy is actually that's something our body would react to. It's a device that we use on the patient.
In short, what all soft lasers do is donate energy to your cells in the form of photons, which helps your cells regenerate more effectively. It works very similarly to the way that the sun works on plants, donating photons, which helps plants to grow.
Okay, so it's the reaction of our bodies to the light, some physiological reaction that happens while doing the therapy that helps our body to heal, essentially.
Exactly. Healing enzymes are released when laser light is applied to the tissues, and toxins are released, and the laser assists the body in making more of the good stuff and getting rid of the garbage so it can heal itself.
Now, a lot of our viewers have probably heard of different types of lasers. There's a lot of lasers you hear for cosmetic reasons, for dental or other types of surgical lasers. How are these lasers different in their treatment?
Soft lasers or soft laser therapy is also known as cold laser therapy or low-level laser therapy because these lasers do not cut or burn. It is an entirely non-invasive process, unlike other kinds of lasers. As mentioned, they gently donate energy to the cells to help with regeneration and rejuvenation as opposed to cutting or burning.
Okay, so a patient would experience very little, if anything, in terms of how they would feel with the treatment. There would be no burning, their skin may react slightly to the energy.
They may feel a little tingling as circulation increases. They may feel a little warming. It's always very relaxing, but there are no negative side effects or downtime or marks or anything.
Okay. And what types of conditions might someone seek this type of therapy for soft laser therapy? What, I understand it has an FDA clearance and also has OTC clearance as well, but what types of conditions might benefit from this?
Soft lasers are used for pain relief, reducing inflammation. They're used for activating the lymph system, the drainage system of the body, for immune enhancement, for facial rejuvenation, and for gland and organ balancing. Soft lasers are also used for laser acupuncture. So anywhere that acupuncture points are on the body, laser light works kind of like jet fuel to stimulate nerve meridians and bodily systems through
Okay, so that's
key
interesting.
points.
So instead of having to maybe see an acupuncturist, if people have a needle phobia or they're concerned about needles per se, the actual laser might generate the same energy at that meridian point, which would help with that patient's condition, based on hitting those certain meridians. So that's good. Now, in terms of other, contraindications, what types of patients may not benefit, or should you be aware of that maybe shouldn't get this type of treatment?
Lasers have been used effectively and safely for 30 years across the globe and 20 years in this country. And the only kind of, we like to be, of course, extra cautious. So you wouldn't apply a laser directly to an active tumor, and you wouldn't apply it to a fetus, an unborn fetus, or shine it directly in someone's eyes. So when we use the laser, eyes are closed, and we stay away from those areas mentioned. But
Is this a new technology? Has soft laser been around for a while, or we're starting to hear more and more about it? So
well, it's being made. What's new about it is different kinds of lasers are being used, and inventors are learning how to modulate the light wave in different ways to do different things to cells. Instead of just donating energy through red light, for example, we're able to activate some cells, we're able to detoxify others, we're able to increase the regeneration of DNA and RNA, working at that level, working within the cell itself. But soft lasers have been used by naturopaths, acupuncturists, in hospitals and clinics, by veterinarians, as I mentioned before, for over 30 years.
Okay, so the technology has been out there. You mentioned light waves as well, which was interesting. Does our body respond differently to different types of light waves, different color of light waves?
Exactly.
And what makes these scalar waves unique in this particular laser that you use?
All lasers have the ability to employ different light waves. The the laser that I use employs all three because different light waves seek out different types of tissue. Red light is used and seeks out soft tissue, such as muscle, gum, and nerve. Infrared light looks and seeks out denser tissue. So it may do some good stuff on the way, to the soft tissue, but it will specifically seek out bone, disc, teeth, cartilage, those kinds of tissues. And violet light is antibacterial and works on the DNA level, works within the cell.
Okay, so it's affecting the cells
So it goes
directly
very
at a
deep.
cellular level.
So
Okay.
so red is shallow, infrared is somewhat deep, and violet light works at the deepest level.
So the lasers have various settings that you can set based on the type of effect that you want, a physiological effect you want to produce in the body, and then the patient would respond over a period of treatments, and they would start to feel better. What's a typical session like? We're going to demonstrate one in a little bit, but what would a typical session be like? How long does it take typically?
Typical sessions run about 45 to 50 minutes. If I see, and I always begin by relaxing the body, if I see that it takes a little bit longer, we may extend that, but the body really takes about an hour, maximum of an hour's worth of energy. After that, you're kind of wasting your time. It's better to do more sessions and spend less time as opposed to trying to just keep working and working. So it's about a 45 to 50 minute session.
And would anyone have any problem doing this at home? I understand that some of these lasers are over-the-counter cleared, so you could actually teach a client or a patient to use these on their own?
Exactly. It's a very interactive process. I mean, when someone comes for a session, I may have them just put it on themselves so they can see that it's very user-friendly and it's very
Get over the
very
phobia
safe.
potentially of
Absolutely.
People hear the word laser, they think maybe heat or cutting or some more invasive type of procedure where it's really exactly the opposite of that. It's more has a more calming and relaxing effect on the body. And now, in terms of working on de-stressing a patient, what would we do to do that? We
always start with the adrenal glands. There's really different ways to unlock and relax the body. There's two major ways that we found very successful. One is by working the adrenal glands, the tailbone, the back of the head, the occiput, which is the base of the brain. Those are key areas for unlocking bodily stress. Reversing the effects of all the cortisol and adrenaline that we're pumping out of our adrenals. Invariably, our adrenals are exhausted more often than not. We never want to activate the adrenals. The other way to relax the body is through the lymph system and the jaw. So you don't even need to have TMJ to have head stress. So another way is through the temples and the jaw, and working from the top down.
So the laser can help with the lymphatic system and help in the drainage of toxins and chemicals in our body that we store over time and that may lead to other types of health conditions, essentially.
That's absolutely a component of every session. There's always a detoxification component. Because wherever there is pain, wherever there is disease, invariably there are toxins and pathogens and viruses that reside in your body. Even if they don't seem to be active, they can hold that dysfunction in place.
And as a holistic counselor and practitioner, you suggest diet, nutrition, other types of things to help support the laser therapy. So when the patients are going home, you need to discuss how they got there and help them with their lives in terms of de-stressing and diet and nutrition.
Absolutely. More often than not, people don't realize what food causes inflammation, both the kind that you see and the silent inflammation that sets up, chronic disease of all kinds, and any word with an itis. So yes, I usually will give them a little bit of direction on simple ways to change the way that they eat that build strong bones. It's really one way of eating, certain basic principles that work to enhance the effects of the laser and help improve health.
And hopefully they'll just continue to improve with all of those recommendations. So we have a special treat today. We're going to actually demonstrate the laser, and I'm going to be your patient today. Terrific. And you're going to show our viewing audience how the laser works, some of the protocols that you may do. And this way they can see what they might experience if they were to seek out this type of treatment. So why don't we go ahead and do that demo?
Let's get started.
All right, thank you.
Okay, now we're going to demonstrate how we utilize the laser and various protocols that we use to address a number of different conditions. As you can see, the lights are flashing within the laser there. It's totally non-invasive. It's not painless. It does not cut or burn the skin. It's actually very relaxing as an experience. Within the laser are 3 different kinds of light. It's blended light therapy because different color lights are used and seek out different cells. For example, soft laser therapy includes red light, which is used for soft tissue, muscle, gum, and nerve. Infrared light seeks out denser tissues. So that's used in cases where we're focusing on cartilage, bone, disc, and teeth. And violet light works actually at the DNA level. It works within the cell, and it's antibacterial. So it's utilized really for any type of detoxification, for regenerating nerve on a very deep level.
So Sandra, the different types of lights can be set up depending on the type of condition maybe you're looking to treat or what the effect you want on the body, I would assume, right?
Exactly. The handheld unit has all 3 lights that we utilize, and then I go in and use probes which have the individual lights to do more concentrated work. So I always begin by relaxing the body, because as a society we run on adrenaline and cortisol, and so our adrenals are always stressed out. And when the body relaxes and gets into a parasympathetic nervous system state as opposed to a sympathetic state, that's when it's able to heal itself more effectively. So I start on the adrenal glands, and I think
that's important to note, because adrenal insufficiency and overstressed adrenals causes a lot of health problems, increased cortisol and other problems. So I think it's important that our viewers understand that relaxing the patient before doing other types of treatment would benefit them.
Yeah, in fact, sometimes just by the process of relaxing the entire body, patients experience relief or a reversal of some chronic pain and issues that they've been carrying around for a long time, because it's the stress state that holds that pain in place and prevents the body from healing itself. So
you place the laser right over the adrenal glands?
Right over the adrenal glands.
Right, okay. And as we know, we have 2 adrenals, so you would do both sides, but for demonstration purposes, we'll do the one side for now. Right. And that would be on a patient for a few minutes potentially, and then you would go on to some other areas?
Yes. A typical session lasts about 45 or 50 minutes. So for demonstration purposes, we're giving you the time-lapse version. Right. So I would start on each adrenal for about 4 minutes. And we unwind the body from key places. The other one being the tailbone, also known as the sacrum. All lower body issues, all roads lead to Rome, and so when you're working when I'm working on lower body issues, I always make sure that the sacrum is relaxed and unwound. And again, you're increasing, by utilizing the laser, you're doing 3 things that are really key to help a body heal. Number 1, you're increasing blood flow and circulation. Number 2, you're unlocking and activating and detoxifying the lymph, which is the drainage system of the body. And number 3, you're improving nerve communication, which is really what sets up all the dis-ease or the discomfort in the first place. So that's what the laser does.
And our viewers should know the lumbosacral plexus is a very rich nerve area. So when you're placing an energy source at that level to affect that nerve plexus, it's very important that it helps to relax the body and proliferate, relaxation basically. So I think that's important to note.
Yeah, thank you.
The other thing is, normally you might do the skin on skin, but for demonstration purposes, I'm wearing my clothes.
Right. It's most effective when placed directly on the skin. We then move on to the second to last relaxation point, key point in the body, which is the occiput, the base of the brain stem. And so after we work on this, and the patient is now breathing from what looks like the sacrum, a more relaxed state. Instead of watching the chest rise and fall, we basically see that the sacrum is where...
So you're looking for a physiological change to take effect before you even go on and maybe treat more of these symptoms versus just really getting the body to relax first, right?
Exactly.
Okay, so that's very important to note.
And now I'm going to ask you, Dr. Siegel, to please flip over, because the last place that we always like to finish the unwind is the thymus gland, which is really one of the governing glands in our immune system. We like to call it the Rejuvenation gland. And it also is right near the heart, so it's good to increase circulation in that area.
So this is still part of the unwinding protocol?
This is part of the unwinding.
Okay, so we're still doing stress. So you do base of the occiput, where the brainstem is another nerve-rich area where a lot of cranial nerves and our cervical spine basically starts at that point. Right. And then the sacrum, and now...
Right. The sacrum, is, by the way, is also an area where viruses reside. So we always want to make sure we do a detoxification or really help move the blood flow in the sacrum area.
What's important to note is I feel no pain, there's no burning. This is low-level laser therapy, so it's a cold laser versus a hot laser. There will be no side effects essentially after this treatment, which is important for the viewers to know. So
right, which we talked about just
right.
a little while back, but it definitely bears repeating.
Yeah.
Okay, so what we're going to now focus on, once the body is relaxed, we go in and address the area of concern. In this case, Dr. Siegel we're going to demonstrate how we work on TMJ, because that's a very popular problem, and what grinding really does is it really helps it locks up the lymph system, which causes a tremendous amount of stress within the body, and it can lead to a whole bunch of other issues that people don't know stem from their TMJ, not just interrupted sleep or head and neck pain. So
what's interesting about TMJ is 89% of it is probably due to stress induced anyway, because it's usually a muscular problem. So if you can't address and unwind the stress in the body, the TMJ in a lot of cases won't clear up, because the neck, the shoulders, the back, cervical spine, and the muscles around the TMJ as well. So
exactly. So what we do when addressing TMJ is we start obviously at the TMJ joint, and we then address areas that are key lymph points in the body. Again, your drainage system that is impeded by all of this slamming and grinding of the jaw. So first we start on the TMJ, and then we move to the jaw. Next place would be right down here. And then we're going to work key lymph points, which includes like the pec muscle, the shoulder blade over the back, underneath the arms, and the groin. Then there's two other areas that we won't be demonstrating right now, but the lymph nodes at the groin area and on either side of the sacrum. Basically, if you put your hands on your hips, where your thumb rests, that's a key lymph point in the body.
So the lymphatics is very important in this type of therapy, because you want the body to be able to drain out toxins, remove toxins, and actually promote the healing process. A lot of therapies in traditional care doesn't always address the lymphatic system, and this is a particular specialty that does.
Right.
Is that correct?
Yes, that's beyond correct. Too often, whether people have gone through cancer or not, when surgery is over, they may find that they have what's called lymphedema, they have swelling, and doctors are most often unable to help the situation. And people walk around in a state where they really don't know how to move the lymph system. If you do a little research, you will find that jumping on a trampoline is very helpful in moving lymph.
So that's a very important point, because all the alternatives are prednisone, steroids, other types of drugs, and if you can actually drain and help the lymphatics increase its production, you'll get better results.
Right.
Yeah. Okay. That makes a lot of sense. So if someone had like a musculoskeletal injury, inflammation, a tendinitis, or bursitis, would the protocols be similar, or might you try different types of probes or lasers that might be more direct for different types of conditions? Because our body responds differently to different sources of light, whether it's infrared, red, or violet. Our body may react differently to those wavelengths. So how does that come into play with the treatment? Invariably,
when I address a specific area, let's just say that it was a muscle strain. I'll go in with the probe and I'll work programs that specifically not only work the muscle, but all the surrounding tissues. So the nerve, you look in an area and you say, okay, what is involved in that area? It's muscle, tendon, nerve. If there's an organ nearby, I will also use the laser to increase blood flow and nerve communication and lymph flow in that area, because the body really does work as a holistic unit.
Okay, so if I had like a tendonitis, oops, I apologize. If I have a tendonitis here, you might focus on this tendon here going across in that area. Okay.
I would use the probe. Again, the probes are used about a ½ inch off the body, as opposed to the hand unit, which goes directly on the skin.
Which we just lost one, but we'll
Yes,
get it. We'll get it back.
Not really worried.
Right.
Crash tested.
Okay.
And you know what's really interesting is
And
that
this
this
is
laser.
a violet light you're using now?
This one right now for muscle is the red.
Oh, the red. Okay.
But which will also work the surrounding nerve and the lymph. If there's bone or disc, I'll switch over to the infrared. But what's really interesting is this particular laser has an FDA clearance, which means it's cleared for pain, for arthritis, for increasing circulation blood flow, relaxation of muscles. It's also got an over-the-counter clearance. So that means that basically anyone can purchase one and take their health on. And that happens quite frequently when we see patients and clients. After they've had several sessions, they may choose to
what's interesting about the over-the-counter clearance for this particular device is it just shows how safe it really is, because the FDA, as we know, would not clear a device if it didn't have a very strong safety record.
Right.
They would not want consumers, I still believe that a patient should be directed on how to use it properly as any other device they would be, but it is a nice feature for this particular device. So.
Well, and we don't leave people hanging when they do. If they do decide to purchase one, they're supplied with an entire book with many different protocols so that they know how to use it for their own health. Another very popular usage for soft laser therapy is for skin conditions, for facial rejuvenation.
Okay, that's very good. Why don't we demonstrate that so people can see on the skin directly how safe it really is.
Right. The only thing we don't do is shine it directly in the eyes. You just need, the patient just needs to close their eyes. We also don't use the laser directly on a fetus or on an active tumor, but anywhere else is quite safe. There are no other contraindications.
So what kind of skin conditions, would psoriasis or eczema or rosacea, would those types of conditions respond well to this treatment?
Exactly. It's used for any kind of skin condition, from stretch marks to acne to rosacea, psoriasis. Very often we will suggest a detoxification element, because as you well know, they say you're not only you're not what you aren't just what you eat, you're what you absorb and process. So invariably we'll ask someone, get a sense for what they're eating, because what they're eating will show in their skin. Sure,
absolutely. The skin is really the largest system in our body, essentially, and it is very telling to other conditions in the body. So if somebody has eczema or psoriasis, well, it may be more of an autoimmune problem that they may be having, so you may have to address other parts of that condition in addition to the actual skin problem. The skin is really just the final end result of an additional problem in the body. So
exactly. They say the first way out is through the skin, and so it's not uncommon to eat something and see it the next day.
So again, this is very comfortable. I don't feel any heat or any burning. You see a little bit of a light coming through the eyelids, but very comfortable and enjoyable.
There are actually 110 programs in this particular laser that I utilize, because you need to do different things to different cells. Always with the adrenals, you always want to unwind and relax them. I want to use it to activate healthy left spin cells. You want that process of healing, or having the body heal itself, to kick in. So I activate certain cells, detoxify others. I utilize certain programs to increase collagen production, and women are quite familiar with that.
How long might patients see results with various types of conditions? I know it's hard to tell because everyone does come in with different starting points, but what have you seen typically for results for maybe skin-related conditions or other types of inflammatory processes?
Well, every body is different. What I see, I'd say 90-something% of the time, is that people always see and feel a difference at the first session. But we like to say, again, because people have a lot going on and bodies unlock and respond at different rates, that at the very outside, by the third session, they have that aha experience. For facial rejuvenation, for example, somebody will walk away and they immediately feel their face tighter. They feel that hollows look somewhat filled in. They look more dewy. There's an instant. I like to look at, say, the laser as both a short and a long-term element, because you have short-term pain relief that you experience immediately, while you're also working on longer issues, in which case the body heals itself and the issues disappear. And this really works because this laser is what's known as a scalar wave laser. Scalar waves are neutral waves of energy. Now, what they're able to do is delete cell memory. Cell memory is very interesting. You may have heard that by the end of a 7 or 8 year period, every cell and tissue in your body has been completely regenerated. Well, then why would somebody have an issue that goes on for 10 to 15 years? And the answer is cellular memory. The content or the information from the diseased or the old cells gets passed on to the fresh new cells that you're making all the time. And so you have the continuation of the condition. Neutral energy, and which is based on.
Well, answer a question regarding that, because I'm interested.
Sure.
So emotions and memory of emotions may come into play with a lot of people's conditions, because
That's exactly
our
it.
body stores emotions deep in our brain, and that cellular memory can get passed through the body essentially. So
That's exactly
some
right.
people have long-standing pain conditions or other types of problems. That cellular memory may be part of an emotional, whether it was a loss of a loved one or a traumatic incident or some other problem that might have set off a continuing problem in the body for that patient. So
Absolutely. They even say that with allergies. A little child could be playing on the grass and have a traumatic experience, or even just be yelled at. And that experience is encoded in that child's DNA, so the next time that they sit on the grass, they have an allergic response.
Well, that's it's very interesting. Well, I think the demonstration has been great, and I hope our viewers got to see how safe and effective this treatment can be. So I want to thank you for that. And just to sum up, the various probes that you've used, red, violet, infrared, if I'm correct, and patients can learn to use this and treat themselves after probably going through professional care to understand how and why this works. So thank you very much for that demo.
Thank you.
Okay, Sandy, thank you for that demonstration. That was very relaxing. Again, I felt no pain. It was comfortable. Just a very good experience for me. Typically, like we mentioned, it would be maybe on the skin. The patient might be gowned for that in-session, in-treatment thing. So, in terms of research for this type of technology, what has been studied out there? What have been the effects that have been shown, that our viewers might be interested in?
There's been over 2,500 pieces of research on humans proving the efficacy of soft laser therapy, also known as cold laser therapy, for a wide range of conditions. Specifically, the scientific community has measured its effects on pain, chronic pain, arthritis, bacterial infection, wound healing, post-surgical pain, a lot of fibromyalgia.
Inflammatory processes.
Allergic rhinitis, exactly.
Different types of inflammation. So, and again, the FDA clearance was for inflammation and for increased blood flow in the area. So that's important to know that it has been studied to be and shown as an effective treatment for multiple conditions, and the safety of the treatment. So that's very good. Now, and we spoke about the nutrition part of it and the diet and following up with the patient. I think that's very important as well. So,
as you see in your practice, we're learning as a society that medicine is not always the answer, and there are horrendous side effects with a lot of drugs, and there's so many things that we can take into our own hands, and ways that the body can heal itself if we are open to it, and we learn from the technology that's out there. So this
well,
is
it's interesting you mentioned that. So if a patient comes in with a whole host of medical conditions, do you have a chance to work with some of medical doctors to try and help describe what you're doing and show some positive effects for them?
Yes, more often than not, it's integrative medicine physicians who have their MD degree and are also involved in alternative therapies who are the most open to this, and that's who I've had the opportunity to work with as an adjunct therapy that they
as an
offer
adjunct
too.
therapy, right?
Absolutely.
And the combination of sometimes working with more than one practitioner could really benefit the patient as well, which is really what we're looking for, the overall health and improvement of the patients. So I think that's very wonderful. So I want to thank you very much for being here. I think it was a very educational show. I think anyone that's seeking soft laser therapy should definitely do their research, find out more about it. I know the scalar wave technology is new and improved compared to maybe some older technologies. And I personally have used cold laser therapy. Low-level light therapy is another acronym for the soft laser therapy, and I've had some positive results in my practice as well. So I am familiar with the technology. So I want to thank you for being here, and we look forward to having you again sometime.
Thank you. And if anybody does want to take a look at the research or learn a little bit more about it, the website is soft-laser-therapy.com, and you can read the studies and get some more information for yourselves.
Okay, great. Thank you so much.
Thank you.